Let's welcome Keisha Collins, Community Healthcare System OBGYN, Danielle Fallon, James W. Curran Dean, Rollins School of Public Health of Emory University, David Jones, Chief Medical Officer, Georgia Commercial Director of Medical Operations, Anthem Blue Cross and Blue Shield of Georgia, and Kelsley Mayo, CEO of Arbor Medical, Inc.
Good afternoon, everyone. Oh, that's not going to work. Let's try again. Good afternoon, everyone. Good afternoon. That's so much better. Thank you. It is such a pleasure for us to be here to have this power panel that will present. We've had a lot of amazing speakers today, a lot of discussion, a lot of take-home points, and so we want to add to that conversation as well. And I want to start by just introducing our panel. You should have access to everyone's bio, and so I wanted to give you the short version so you have an idea of the level of expertise that our panel is bringing to you today. I'm going to start with Dr. Fallon, and she is not only the dean, but she's also a public health researcher, and so we do have that research component. In addition, we have Dr. Jones, who's a CMO, but he's also a pediatrician by training. And then we have Dr. Mayo. She's a CEO of Arbor Medical, but she's really a biomedical innovator. And then there's me, yours truly, and I am an OBGYN, and I will be the clinician component in terms of our conversation today. So I like quotes, and for those of you that may know me, I love lots of quotes, and I'm going to start with this one. Those closest to the problem are also the ones closest to the solutions. That's us. Everything that we experience with our patients and our community is what drives the changes that we need to see. So with that, we're going to talk a little bit about some of the words that we've learned today. And I like alliterations, and of course we're talking about collaboration, but also a lot of other C words were shared today. Connection, caring, consumer, community, curious, compassionate, core values, cross-talking, and I'm going to add two other C words, cross-sectional and also cross-pollination. So I want you to think about your C's. So with our conversation today, we're hoping that you'll learn a couple of things. First, the power potential of a collaborative mindset and the importance of multi-dimensional partnerships. And I brought my prop here. This is actually the 50th year of the Rubik's Cube. And as we think about problems and challenges, we know that as difficult as a Rubik's Cube is, it's a solvable problem. And so as we think about maternal and infant health, that is also a solvable problem. We'll talk about a couple of strategies of transformational leadership, success, and adaptability. And then we'll end with a call to action for all of our healthcare leaders, our healthcare influencers, and our healthcare professionals. So with that, we will get into our questions, and we don't have a lot of time because we have a very important topic. And as we're branching into our questions, our discussion today is about maternal and infant health. But I want to give you the framework because a lot of our conversation will focus primarily on our moms, and that's because we know that when moms dazzle, everybody shines. Our kids will do well if our moms are well. And so a lot of what we're talking about today will be focused on our moms. So the first question, I'm going to ask each of our panelists to chime in and just tell us a little bit about how you've executed collaborative strategies, and also tell us about the scope of impact. How have you been able to measure that? And Dr. Fallon, we'll start with you.
Sure. Thank you so much. It's a privilege to be here with all of you. So as Dean of a School of Public Health, I come from an academic public health perspective to this conversation. And so when we think about collaborations, our traditional partners in many ways have been public health sector government. So we work very closely with Georgia Department of Public Health on things like home visiting, on evaluation of maternal morbidity and mortality work, many of those kinds of things that really bring together our academic versus their practice work. The same is true of Department of Community Health, where we get to help evaluate things like the recent 12-month extension of Medicaid for postpartum time period. So those are great, and I should say also CDC work, both here in Georgia and across the country in terms of measurement and communication about maternal and child health. But maybe not as obvious, but really important for us are partnerships with other academic institutions. So we now have close collaborative work with Mercer, represented here, and the Morehouse School of Medicine in a couple of ways, and I'll tell you a little bit more about that. And then also with community-based organizations. There may be several in the room, and I don't want to list one because then I would, of course, not list all of them, but there are many in Georgia that are deeply focused on maternal health or maternal and child health, and it's a privilege to get to work together with those folks. So some examples of those kinds of collaborations are, we have something called Coral, which is a collaboration between Morehouse and Emory to support women, specifically Black women, through physical and behavioral health challenges across pregnancy and postpartum. And what I think Keisha already mentioned, but what you'll hear a lot about from all of us, is the intentionality around health equity. And so this is a very specific project paying attention to one aspect of known health disparities in the maternal health space here in Georgia. Another example that I think is still evolving and all of you can be a part of is for lack of a better term, a maternal morbidity and mortality working group, which is simply an open tent to bring folks together across the state of Georgia from academic institutions, so again, things like Mercer, Morehouse, Georgia, Augusta, other places, with our healthcare providers and hospital systems and with our community-based organizations to hear about what each other's doing and to try to amplify and support without duplicating what each other's doing. And that has become a really, I think we'll talk about challenges in a little bit, but that has become one of the main challenges for us as a state is how do we all feed each other and align together so that we are uplifting the really incredible work that so many people in the state are doing across these different sectors. And that's, I think, a great theme for Health Connect South. Thank you.
Thank you. Very good. Dr. Jones?
Great. So again, yes, it's a pleasure and honor to be here with you all and you all as well. So I'm at Anthem Blue Cross Blue Shield of Georgia, and we, first of all, I want to say we're evolving from being, let's say, considered only a payer, if you will, really looking to evolve to be more of a lifetime trusted partner, a partner with our members, individuals, community leaders, and also partners across the healthcare spectrum as well. So it's really kind of where we're evolving. And so as far as the collaboration, I can talk about in a cross-sectional fashion, to use one of your C words. We sort of engage at the national level, the state level, and at the community level, the most important level. And so at the national level, our foundation, the Anthem Foundation, is committed to impacting health equity as is one of its priorities. And to substantiate that, we granted $30 million over 3 years specifically to maternal health grants in the different markets where we are. And specifically, in looking at specific metrics, and particularly around reducing C-section rates, reducing preterm births, and also reducing low birth weight infants, and improving maternal mortality and morbidity. So really specific metrics to look at. And so that's at a national level. And then at the state level, how does that look? So here in Georgia in particular, $6 million of those dollars, those grants, are going towards specifically to funds in Georgia, particularly to expand doula services across the state of Georgia. And $1.75 million went to Morehouse School of Medicine specifically for their doula program to expand it by additional 60 doulas training, as well as 150 plus lactation consultants, and also trying to expand the access to doula services across rural parts of Georgia as well. So really trying to make those meaningful improvements for access to care, particularly with doulas, because doulas, some of you may know, some of you may not know, they've shown really great impact in those metrics. We're almost like 14% reduction in C-section rates, reduction in NICU admissions, reduction in low birth weight infants, so really meaningful impacts, and also great emotional and support impact to the mothers and families, both before and during and postpartum. And then at the community level, it's not through the foundation, but that's where the really direct interactions in the communities are really, I think, make an impact, and we do those in multiple ways. One is around our value-based care programs, really expanding those across Georgia and trying to optimize the impact of those value-based agreements we have with providers, trying to expand actually access to primary care across Georgia wherever we can, working with medical societies, specifically the Medical Association of Georgia, particularly around maternal morbidity is a big priority. And so those are just some examples. And so I think the key is, as we're going to talk more about, partnership is so critical at all levels, especially at the community level. And then more specifically, really looking to have partnerships and function in ways that sort of erase traditional roles in healthcare, really try not to be limited to one lane or one focus, and really have to organize ourselves in ways that we wouldn't have imagined or didn't imagine before. That's really going to be the main way and only way we really make meaningful, large-scale differences. So.
Thank you, Dr. Jones. Dr. Mayo?
Well, hello. My name is Kelsey Mayo. I am the CEO and co-founder of Armor Medical. So we are a med tech company. We are really focused in on women's health and specifically on improving maternal health outcomes. So I'm so honored to be sitting in this panel today, and I wanted to actually perhaps make this a little bit personal. And Keisha, something that you said to kick us off earlier was, the people who are closest to the problem are oftentimes the ones who are closest to the solution. And so let me back up and say, number one, I'm a hell of an engineer from Georgia Tech. Are there any other Georgia Tech folks in the house? All right, fantastic. Then I got my doctorate at Vanderbilt and have always been hugely passionate about precision medicine. How do we drive forward the next wave of healthcare innovations, especially in the area of women's health, where there's so often a lack of innovation? And so, my journey as a founder really sort of started from an academic perspective, a recognition that, hey, let's look globally. The number one cause of maternal death worldwide is hemorrhage or severe blood loss associated with giving birth. And as an engineer, what was shocking to me is that providers really just do not have great tools to detect hemorrhage early. If we did, if we had tools that allowed us to detect hemorrhage and treat hemorrhage at earlier stages, we could prevent the majority of death and morbidity associated with hemorrhage. So again, I sort of started from an academic perspective, recognizing, hey, I'm an engineer, nobody is solving this problem, why don't we step up and do it? And that was the starting point. Well, fast forward about a little under a decade later, building my own career as an entrepreneur, I am also a mother. We have two beautiful babies. My oldest is 7, my youngest just turned, or he's almost 7, he turned 7 in like 2 weeks. My youngest just turned 3, and between my two babies, I actually survived a hemorrhage. And this was a point in my life. It was not a maternal hemorrhage, so I was not pregnant at the time, but I had one of my ovaries grew an ovarian cyst. I had no idea. I was sitting in my office, and that cyst grew so large it twisted one of my fallopian tubes, ruptured, and I actually almost died. I was dismissed when I went into the emergency room. I dismissed my own symptoms. And what could have been a simple laparoscopic procedure, had we known what was going wrong, ended up being blood transfusion, life-saving surgeries. And I will say, every time I share my story, the parallels that I get from folks in the audience, and many of you whom I have spoken out in that hallway today, it's just astounding. These are really issues that affect our families, affect our communities, and we can do something about it. And so really when I look at sort of my why and why I went on this journey, that was my moment. It's like, hey, I recognize this from an academic perspective, and then I lived it. So that's why we started our company about 2 years ago. And we were talking in this first question about collaboration. And I think the journey of starting this company and getting our product, which is essentially a wearable device worn on the mom's wrist that helps to act as an early warning system for hemorrhage, getting that from an academic idea to an innovation, a product that serves people and addresses the issue that we set out to serve, it requires collaboration at every single stage. And what that collaboration looks like changes throughout the life cycle of that innovation. So in the interest of time, I'll kind of keep it short, and then I hope you come up to me afterwards and ask me about anything that we're discussing today. So number one, I'm an innovator. The first collaboration that resulted in our company started with an academic partnership. So my two co-founders, Dr. Christine O'Brien and Dr. Leo Shmoylovich, they are faculty at Washington University in St. Louis, and they were the people who invented our device. Dr. O'Brien and I are actually colleagues from graduate school, and she has a lifelong passion for solving problems in women's health. But I will say that that first academic partnership, really working with faculty, with brilliant minds sitting in our academic institutions all over the country, and thinking about, great, the science worked, how do you actually translate that into a product? That is a pivotal moment of collaboration. And so I can't thank my colleagues enough, my co-founders enough, but also the academic partnerships that sort of are the nexus, that first starting point in an innovations journey. Now, great, you're spinning out a company, you're trying to get this product, this idea into a product. What comes next? So there's two things I want to mention. Number one, our biggest investor is HHS. And I say investor, I should say funder, right? We would not be here today if it were not for grants from the NIH and the CDC. So I would like all of you as taxpayers to maybe give yourselves a round of applause. So thank you so much for really helping to fund these type of programs. I don't know if people realize just what an important role HHS and other these agencies play in getting high risk but high reward innovations out the door. Number two is actually, okay, great, so you have this idea, you've got some funding. What do you need to bring in next? You need to bring in the community you're trying to serve. This is extremely important in the world of women's health and maternal health. So one of the things that our company did is not only did we go out and we talked to patients, we talked to moms, we talked to doulas, we talked to nurse midwives, OBGYNs. We set out to think, okay, we're gonna actually just co-develop this innovation with the people we want to use it. And I think that that's too often missing. You don't wanna go out and build it and hope that they will come. You want to build this with the people that you're trying to serve. I think that's huge. And then I'll wrap it up and just say, as you're now moving, you've got this product, you've built it alongside the people you're trying to serve, now you need to actually get it out there on the market. You need to get it into the hands of the people so you can change the standard of care. That requires the collaboration of a whole new group of stakeholders. And so we're talking payers, we're talking healthcare systems, we're talking providers, these perinatal quality collaboratives, like everywhere along this ecosystem, we have to be aligned in order to actually get these solutions into the hands of providers so that we can serve patients. And I think so, again, just every stage of the way, the collaboration may look different, but it's a critical component.
So tonight when you go home and you're asleep, you're going to wake up and say collaboration. That's all that's going to happen.
Yep.
Thank you, Dr. Mayo. And I just wanted to add a little bit to that. So I wanted to share that I work with a federally qualified health center network. It's called Community Healthcare Systems. We're in Central Georgia. We have 18 sites. And I wanted to speak to the fact that the rural component of what we're doing is so important. So we know that 82 of our counties have an OBGYN. The rest don't, and we have a total of 159 counties. I work primarily in Twiggs and Jones County, and a little bit in Liberty County. And in Twiggs and Jones County, I am the only OBGYN. So I have one of my students with me here today. She's going to OBGYN. I'm gonna give it a shout out to Minal. But that's a really important concept when we think about collaboration and what it means and going out to where people are. And so when I think about collaborative strategies, what we wanna make sure of is that regardless of where our patients are living, they have access to quality care. So there's like Atlanta, and there's not Atlanta. I learned that this week. I'm stealing that. That's not original. But regardless of where you are, if you're in Sparta or Rennes, or you're in some other county, you should have access to quality care. And if it does not exist in your county, then the health network in your area should be able to connect you, sometimes even expedite your access to that care. And so what we're talking about today is how do we work together? How do we make sure that regardless of what your zip code is, you can have what you need. And so I'll talk about 2 programs, and I want to get a show of hands. How many people are familiar with GAP QC? Okay, that's great. Not enough. So, homework. I'm a teacher sometimes. My daughter just turned 16. She's my youngest. I'm breathing slightly because she's driving now. That's a whole nother story. But I want you to Google GAP QC. It's the Georgia Perinatal Quality Collaborative. Everyone should know what that is. And the really nice thing is they're designed to help with initiatives for our large hospitals, our large institutions, but also for the small hospitals. So we have several initiatives right now that are targeted towards addressing the main causes of maternal mortality. So we know that mental health was mentioned as a concern. We know that hemorrhage is mentioned, also stroke and cardiovascular disease. So there's actually a whole initiative regarding cardiovascular health for women who are pregnant. And believe it or not, I know Georgia is not first for a lot of great things, but we are the first state in the country to implement this collaborative for our women. And that opportunity is not just for our large institutions, but it's for small hospitals too. We have a rural support component. And so when we think about collaborative strategies and impact, we want to empower our healthcare team wherever they are to be able to make that impact. Another show of hands, how many people are familiar with Peace for Moms? PEACE. Not enough hands. Okay, homework number 2. So Peace for Moms is a program that was sponsored actually through Emory, and it is designed to help to meet the perinatal mental health needs of our state, and I use them all the time. So regardless of where you are, if I have a pregnant woman or postpartum, I had a patient recently who was postpartum and was very anxious, and she was having a meltdown. She had a preterm delivery, and the baby was in the NICU, and I was not sure how to manage her. You can call, any provider can call, wherever you are in the state. Within 30 minutes, a psychiatrist will call you back, and they will give you advice on what to do with that patient. If you do not have resources in your community, they will help coordinate that for you. So that's the kind of equity driver or equalizer that working together can afford our patients. Because it doesn't matter where I'm practicing, I can make that call. And so I do want you to research those 2 programs, but that's just an example of how collaborative work will help to really expand our access. And we had a wonderful presentation at lunch, and we were graced with our governor's wife's presence today, that 988 is a really big deal. I actually have my patients to save it in their phone under the title of help. So if they are feeling like they're in crisis, they don't have to Google to find the number. They can just search for help, and they can do that. Easy things that we can do. So it would be nice, maybe eventually we'll have lots of phone numbers like that for everything that we need help with, but I digress. So as we're about to go into our second question, I wanted to share a couple of fun facts because I want you to, I know that you understand how smart and accomplished our panel is, where they're just ordinary people doing extraordinary things, and so I want to give you a couple of touch points so you might connect. And so Dr. Mayo wants to be a master gardener. So if you like gardening, you might want to touch bases with her. Dr. Jones likes tennis. And so if you're interested in tennis, you can talk to him about that. And Dr. Fallon is a smoothie drinker, specifically kale and beets. Did I say that
Kale
right?
and carrots.
Kale and carrots, I'm sorry. Yeah, I got that wrong. But so if you like fruit juices, you might want to talk to her about that. And I wanted to share that I am Jamaican. You probably don't know that because I don't sound like I have a thick accent, but if you make me upset, you will absolutely hear it. So with that, now that we're getting to know each other, I want to move into our second question, which is focusing on confronting challenges, and then also how we work on our success factors, because the work that we're doing is not easy work. And you're doing it, and everyone here is contributing in some way because we care about the outcomes for our patients. And I'm specifically not highlighting the negative statistics that we have in our state, because I just think of it as a jumping board. And when you leave here today, I want you to think about what collaborative opportunity do I need to pursue so that we can move things forward, so that we can move the needle. So with that, I'm going to open it up to our panel, and I want to start with Dr. Fallon and just asking you to talk about challenges that you faced in the work that you're doing, and then also what are some of the success factors that have helped to propel you forward.
Great. So I hope that you will talk about the challenges of geography and the challenges, many of the provider challenges that folks face. So I won't talk about those, but I'll stick with 3 things. And the first one that I think is a real challenge, but where we have an opportunity, is trust. And I mean that in many ways. So first, I mean building trust with each other in the multiple disciplines and sectors represented in this room, approaching each other with humility that you're bringing something to the table that's different than what I'm bringing to the table, and building trust in each other and what we can accomplish together. And then I also mean trust with our communities. And really, that takes time, that takes listening, that takes creating space for that kind of listening and action that we often, we're at this frenetic pace. We see all these things that we need to get done, and so sometimes that's the piece that doesn't get the time and attention it needs. But it was already mentioned that you're building a new product. That product really will not manifest the impact you want unless you've had that qualitative work listening to both the folks who will be the distributors and the prescribers of something, but also the folks who will be the users. And that is just true in all aspects of what we do. So it is absolutely a challenge because it's not easy to build trust, but I think something where we can accomplish. So that's number one. Number two, in a past life, I was chair of a department of mental health housed in a school of public health. And so I got to champion the perspective that we can bring to public health by thinking about how mental health affects all of the things we do. And so Keisha mentioned, in addition to hemorrhage, which is a major cause of illness and unfortunately death related to pregnancy, depression and substance use, which are mental health or mental and behavioral health conditions, same story, a huge driver of illness and unfortunately death related to pregnancy, and really related to maternal and child health, much larger than that. And so when we think about that challenge, those systems are often segregated. The physical health system and the behavioral health or mental health systems are often segregated in the healthcare system, in the social services system, in all other sectors. And so the challenge of bringing those together is a really important and sometimes feels insurmountable one. And the challenge of addressing some of the other aspects that come with bringing mental health into the story, like stigma. And, often you'll hear someone say, I didn't disclose or I didn't go get perinatal or prenatal care because of my substance use. I don't want to be detected and then separated from my baby once it's born. Those are real issues that we have to face if we want to promote the health of both those moms and the children. Depression, same thing. It's often hard to disclose in your family setting, in your work setting. And so we really have to work on those. And we're lucky that in some ways, can we say lucky when we talk about COVID-19? I don't know. We can see the silver lining that one thing that COVID brought to us all was an awareness of mental health and a different level of acceptance of disclosing your suffering in a psychological way. And so I do think this is another challenge where there's hope. We are at a moment where bringing those two worlds of physical and mental health together is possible. And so I'm thrilled to see us push in that domain, despite the negatives that part of it. So don't take away that I thought COVID-19 was lucky. And then the last one I'll say is, it's true here in Georgia, it's true in many places in the country, our just need for alignment. The challenge of alignment is real. So we are not a state that is lacking in really smart, talented, and passionate people and organizations that want to address maternal and child health. That is not our challenge. Our challenge is how do we cross-fertilize? How do we understand what we are each doing? How do we amplify and support the work of those different sectors without being too duplicative? And so this challenge of just information sharing and then being supportive, it seems like it should be obvious, but there's real work involved in trying to understand what each of us is doing and trying to figure out how we align where there are still gaps. That work is a huge challenge, but that's one that I think is another success story in the making. And I'll just give you one example of where I peripherally, through engagement with Emory, have been involved, and that's if some of you were here this morning for a talk with several of the DHHS and HRSA and ARPA-H folks. Darshak mentioned the ARPA-H Heroes program, which is a incentive-based program that says if you take a particular geographic area and you can move the needle on a particular health outcome. And in maternal health, he was talking about obstetric complications related to pregnancy, during pregnancy and the first 60 days after pregnancy. If you can move that needle, then you will be incentivized and paid for doing that. And so we at Morehouse, led by Morehouse, but with collaboration of Emory, and then also with collaboration of many of the healthcare providers in the Atlanta perinatal collaborative region, and with many of the community-based organizations, are coming together, made it past the first round of, yes, this is a great idea, now give us the real story, give us a real proposal. And that has brought these different sectors together and sort of demanded alignment, because we won't be able to meet those requirements and receive that kind of incentive if we don't align together. So I think that's a great example of a real challenge and a place where we can try to address it.
Thank you. That's excellent. And I'm going to kind of build on President Carter's words earlier. He talked about accelerating progress, but I'm going to add alignment accelerates progress. So that was well said. Thank you. Dr. Jones?
Thank you. So when I think about challenges, there's two aspects come to mind. One is a very tangible challenge we're all, I think, familiar with, that's around social drivers of health. And the other one is really about our mindset. That's a different challenge. So I'll start with the social drivers of health first. And I think we know we're very good at identifying the different social drivers of health. And I think we're very good at screening for that in multiple capacities as well, which is great. But I think the next advancement, if you will, in healthcare more globally should be around specific actions and meaningful actions to address those disparities and address those drivers. And so within Anthem, we've developed something called the Whole Health Index. And this was actually a validated methodology to quantify the overall whole health of an individual and or a community. And there's multiple different parameters, health, social, clinical, go into that. And that is something that will allow the connecting individuals and communities to specific resources that in a more precise way, you talk about precision, in a more precise way at a very individual and community level, and being able to quantify the impact of the interventions on that individual or those communities overall. And I think it's a very powerful tool, and the methodology has actually been validated by Mathematica and published in the New England Journal of Medicine in 2023, so it's really powerful, and Georgia is one of the 3 states we've started to launch it in, so more to come on that, but I think that's exciting, more actionable aspect of the next phase, I believe, around addressing social drivers of health. And then the second challenge in my mind, as I said, is about our mindset. And what I mean by that is really how we think about the problems we're trying to solve for. And I bring that up in this context in particular because if we talk about maternal and infant health, and I think traditionally or conventionally, we think about maternal health, we think about when the mother gets pregnant, through gestation, and then maybe postpartum period, and the infant maybe the first few months of life, in a very finite sort of life. But we should think about their health more broadly than that. We know the infant's health is impacted by the mother's health, especially during pregnancy. We know that's a continuum there. However, the mother's health, when she's pregnant, was impacted by many factors for several years in the preconception phase of their life. And so there's many factors go into that for a long period of time, and some of those social, some of those physical, and other aspects too. So my point is that we should look at things like maternal and infant health at a more broader scale, and our overall health, throughout the lifespan lens, for much longer periods of time, both preconception and postconception. So that's one way. Just in general, thinking about the problem we're trying to solve for in a broader way is really critical. And then the last piece I'll touch on, it kind of dovetails on your comment about trust. Trust is both, in my mind, both a challenge and a success factor, because I believe that is such a critical part of anything we do, particularly in healthcare. And I say that particularly as a pediatrician, practicing over 20 years, if there's one thing that I learned in 20 plus years and it's the most humbling thing to me, and I tell parents this repeatedly, for a parent, every parent I think agrees with this, for a parent to trust the health of their child when they're well, especially when they're sick, to another person, is truly the highest honor, and it's the most humbling thing. And so that trust factor, it's so powerful in connecting and healing, and when it's not there, it's a problem. It's a big barrier. And when I say trust, it's trust of others in the healthcare system at large. It's the trust within the healthcare system of the different partners, as you mentioned. I think the trust factor, it's been tenuous for a while. It can be maybe fragile post-COVID, but I just wanted to emphasize, I think that's such a critical piece of anything we do, and really, especially if we're going to do things that are bold and challenging.
Thank you, Dr. Jones. Very well said. Dr. Mayo.
I'm sitting here absolutely floored by some of the things that you guys are saying in the best way. I mean, it is really striking to me because so often we think of things from, like, what is the next high-tech gadget gizmo thing we can do? And I think that is absolutely part of what we do to solve problems. But, just it's the human side of what we do. That's this theme that I keep seeing throughout all of our discussions. So particularly in the world of maternal and infant health, I think that just comes through so strongly. So I love being up here with my fellow panelists. As an innovator and thinking about challenges, I am a female startup founder in the world of women's health, and innovation requires investment, right? It takes a lot of resources to get ideas from the benchtop to the bedside. And so I know that we just heard from a panel of incredible investors, and I think that I would just underscore something that my colleagues in women's health and I talk about a lot, and that is, it's challenging to get the resources to do what we're doing right now. There's a quote that I wanted to sort of lead off with here, and I'm going to read this to you, and then I'm going to ask you what's missing. Policies and programs are most effective when informed by the people they affect, and when equity strategies are built in to tackle drivers of health disparities. What's missing? We talked about policies and programs. Products. Policies, programs, and products. The things, the innovations that we are taking to market also need to be informed by the people they affect. And so what I think is powerful is what we now see in this wave of women's health. 60% of women's health companies here in the US were founded, I think, within the last 6 years, 6 to 10 years. We've seen a 1,000% increase in the number of startups in this space, and I think it's because women stood up and said enough is enough. And because those often that are closest to the problem are often closest to the solution, to kind of bring us full circle. And I'm also really proud to say that we're seeing progress and investment. Some of the people that were on the stage earlier are the people who are looking at this wave of innovators and saying, yes, that's the horse that I'm going to bet on in this race. And part of that reason is because your lived experience is a powerful, powerful tool to actually solve the problems that you're seeking to solve. And so I would say that a challenge as a founder is getting the resources to be successful in getting these products to market, but I'm also very encouraged because I am seeing people step up and I'm seeing people that are willing to invest in this space. When I first started, women's health was not in the news constantly. Maternal health was not in the news constantly, and now it is. And I'm proud of that, and I'm proud to see that this change and the tailwind in this space. And so we have to keep it up because even in the face of this tailwind, women-owned companies are still only receiving 2% of all investment from venture capital, okay? And so we're making progress, but we have a long way to go. This is not the only type of capital. There's another type of capital that's really important, and that's relationship capital. And that's another thing that I think is both a challenge and a success factor. In thinking about all of what needs to happen in order actually to get these products to market, you have to do an amazing amount of networking, and that's what we're doing here in the room today. That's something that I think is really brilliant about Health Connect South, is the people that I see in the hallway, I know from different areas of my life, but we're all here together. And when we're here together, we can have these hallway conversations, we can build these networks and actually get in the room where we can drive forward change, we can implement solutions. And so, I think that this sort of relationship capital that we are all building here today, and that hats off to folks like Dr. Callens who are doing the hard work of connecting the dots all across the state and the Southeast. This is how we get things done.
Thank you very much. So there's so much, and it's very clear that we have a lot more to say, but I see this clock running, and so I'm going to go into Speedy Gonzalez mode, and I do want to share challenges that I've experienced and just some of the things that we've done to address that. So we've talked today a lot about social drivers of health, social determinants of health, and as I mentioned before, we want patients to be able to access the appropriate care. And one of the things that I found was, when it comes to monitoring women postpartum for things like preeclampsia or hypertensive disorders, did you know that everyone who leaves the hospital should have their blood pressure checked within 72 hours? That is something that is recommended by ACOG or a governing body. How many women do you think get access to that? Not enough. And so at Liberty Regional, we wanted to really work on how we're able to monitor moms when they went home. And so when we started this idea, we started when moms go home, we would connect them with a cardiologist in 2 weeks, and they would see their OB/GYN in 1 week. But we wanted real-time information to be able to intervene if we needed to. And so I tried to order a blood pressure cuff through the insurance company. It took me 105 minutes and 5 days to do that, and I thought, this is not going to work. So through a lot of collaboration and some grant funding from the Annie Casey Foundation and working with the OB/GYN Society and working with Family Connections, we came up with a program called Mom's Heart Matters. I don't have enough time to give you all the details, so I want you to Google that homework assignment number 3. But the real short version is when women come in, before they go home, if they have an elevated blood pressure, we give them training, we send them home with a blood pressure cuff, we download an app on their phone, they take their blood pressure, they do not have to call us, they do not have to enter it into an app, it automatically uploads to the cloud, we see it, and we do that 24/7, and we can monitor them and we can intervene. We have kept our moms out of the hospital, we have changed their medicine, and then we've brought them in when they needed to come in. And that is a real-time thing that we can do. So it addresses 2 things, the ability for us to diagnose things quickly, but also for us to be able to intervene. So is it challenging to monitor moms postpartum? Yes. Can we find innovative ways to do that? Absolutely. So short version, we have 3 minutes. So fun fact I will share because I really want you to connect with our panelists today. So Dr. Mayo was in the singing bee. Very interesting. You should talk to her about that. Dr. Jones, the mascot for Duke, one time because his roommate did that, and so he volunteered to switch out. And Dr. Fallon is a runner, so anyone thinking about improving their health and outcomes, and we talked to her about that. And my share is my dream job or dream opportunity would be to do the music bumpers for NPR. I just love listening to those segments. Really cool. So as we wrap up, we have 2 minutes. One word, one call to action that our audience should take home today in terms of being able to work together to improve maternal and child health outcomes. So we have 2 minutes. So you're up first, Dr. Fallon.
All right, I'll be very quick. You gave the word alignment, which I love, but the word that I had chosen was a word you might all not know called syndemic, which is putting synergy and epidemic together. And if you leave here the syndemic of physical and mental health, that the 2 are deeply intertwined and really can't be separated. They feed off each other towards health or they feed off each other towards illness. So my word related to the topics today is syndemic.
Okay, thank you. Dr. Jones.
So mine is, it's 2 words, continuous improvement. And I say that in, again, how we think about how we're doing our work every day and problems we're trying to solve. And within continuous improvement, I think about, thinking about systems more broadly, not just the lane that we're in and what we're focused on today, and the problem at hand, and the narrow problem at hand. B, data-driven, and also making sure we're doing solutions that are going to move the needle and we can measure that improvement, and using data to remove bias as much as we can in healthcare. And then the third area, probably the most important, are customers, the voice of the customer, driving value for, and I mean the patients, the members, and any strategy that we design, implement, needs to come from meeting a need, driving value for them, and also they need to be a part of the solution to implement it.
Okay, thank you. Dr. Mayo.
Brave. Be brave. The definition of insanity is doing the same thing over and over and expecting a different outcome. To achieve the level of systemic change that we can and will achieve, it requires people to do things differently. So I think that's my call to action, is try something that you haven't done before. Think creatively, think differently, and that's how we're going to achieve change.
Thank you. So you'll have some other words in your sleep tonight. So my 2 words, interdisciplinary. You know, you think about diagrams, and sometimes they'll have a circle in the middle, and then they have these spokes going out. But interdisciplinary, all the circles are kind of overlapping, and the work that we're doing has to be interdisciplinary. So we cannot improve health if we are not talking to the Chamber of Commerce, if we're not talking to economic development, if we're not talking to our legislators. All of the parts are important, our educational institutions, everybody needs to be involved. And my second word is utilization. Thankfully, our legislators have been very kind. We have the 12-month extension for postpartum Medicaid, but we need our women to utilize that, right? We have it, but are the women who have had cardiac issues or who have had hypertension, are they seeing a cardiologist? And I'm running into my moderator privilege now. I know, we're out of time. But just really thinking about how we improve utilization. We have stuff, but are we using it effectively? And that is a challenge that we have today, to make sure that we're doing that. So as I wrap up, I heard this quote, and I love quotes, you know that already. Change happens at the speed of trust. I've updated that now. Transformation happens at the speed of trust. And when we think about trust, it's 2 things. Sometimes we're building trust, but a lot of times we're repairing trust, because we're having patients come to us that have had experiences that have been negative. And so we've got to repair that bridge, and that's our work. And I'll leave you with this one thought. So for those of you who are Rotary members in the room, you know we have the 4-way test that we say at the end of each of our meetings, and I'm borrowing that philosophy here. As we do the work that we're doing, I wrote 4 questions. Does this build trust? And we've all talked about trust today. Is it fair and beneficial to all concerned? Number 3, will it promote collaboration and build better partnerships? And lastly, is inclusion and, I can't even read my own handwriting. I don't know what this says, but is it coordinated? Because that's the problem with our alignment. We have things, but is everyone working together the best way? So I do think we need to have those internal questions. Teamwork really does make the dream work. I want you to give a round of applause to our amazing panel for the health leadership that they're doing. Thank you.